The National Asthma Education and Prevention Program, the NAEPP, was initiated in March 1989 to address the growing problem of asthma in the U.S. The goals of the NAEPP are to raise awareness of patients, health professionals, and the public that asthma is a serious chronic disease, to ensure the recognition of the symptoms of asthma by patients, families, and the public, and the appropriate diagnosis by health professionals, to ensure effective control of asthma by encouraging a partnership among patients, physicians, and other health professionals through modern treatment and education programs. To accomplish these broad spectrum goals, the NAEPP works with intermediaries, including major medical associations, voluntary health organizations, and community programs to educate patients, health professionals, and the public. The ultimate goal of the NAEPP is to enhance the quality of life for patients with asthma and decrease asthma-related morbidity and mortality. The NAEPP objectives for patients and the public are to increase public awareness of asthma as a significant public health problem, to increase public awareness of the signs and symptoms of asthma, to improve the knowledge, attitudes, and skills of patients regarding the detection, treatment, and control of asthma, particularly in high-risk populations, to define guidelines for effective asthma education programs, to promote development, dissemination, and the use of patient and family education materials. The NAEPP objectives for health professionals is to increase knowledge, attitudes, and skills of all health professionals regarding signs, symptoms, and management strategies for asthma, to encourage health professionals treating patients with asthma to adequately track and monitor patient status and to use objective measures of lung function, to assist and encourage health professionals, schools, and continuing education programs to include up-to-date and accurate information on diagnosis, pathogenesis, and treatment of patients with asthma, to promote and encourage the concept of active patient participation with the physician in the management of asthma, to develop resources and materials for use by health professionals, to promote research to answer unresolved questions about underlying causes of asthma and appropriate asthma treatment and management practices, to address the clinical issue of diagnosis. The action steps recommended for the diagnosis of asthma is to use medical history and physical examination to determine that symptoms of recurrent episodes of airflow obstruction are present, to use spirometry in all patients who are greater than 5 years of age to determine that airway obstruction is at least partially reversible, to consider alternative causes of airway obstruction. To address the clinical issue of managing asthma long-term, the goal of asthma therapy is asthma control, which means you want to reduce impairment and to reduce risk. To reduce impairment, you want to prevent chronic and troublesome symptoms like coughing or breathlessness in the daytime, in the night, or after exertion. You want to require infrequent use, less than 2 days a week, of inhaled short-acting beta agonists for quick relief of symptoms, not including prevention of exercise-induced bronchospasm or EIB. You want to maintain normal pulmonary function. You want to maintain normal activity levels, including exercise and other physical activity, and attendance at school or work. And lastly, you want to meet patients' and families' expectations of and satisfaction with asthma care. To reduce risk, you want to prevent recurrent exacerbations of asthma and minimize the need for ER visits or hospitalizations. You want to prevent loss of lung function, or if it's a child, you want to prevent reduced lung growth. And you also want to provide optimal pharmacotherapy with minimal or no adverse effects.